heart attack risk halved in those with heart disease taking tailored doses of vitamin D. Now, what makes this study quite unique is this. What researchers wanted to do is actually measure the blood levels of vitamin D, not just the consumption of a vitamin D supplement per se. So their target was about to get the blood levels about 40 nanograms a milliliter and keep that range between 40 and 80, not any higher than 80. And of those that, how would you say, achieved that target level of 40 nanograms per milliliter, it was about an average of 5,000 IUs per day they were taking per se. The results were quite remarkable in regard to helping with heart disease prevention. Now, ironically, after the 4.2 years, a lot of individuals, about 21% to be precise, did not make that target level, even with tailored dose of vitamin D after 4.2 years. Now, the interesting part about it, when individuals came in, about 85% were deficient in vitamin D that had heart disease. And the average amount was about 26.8 nanograms per milliliter. So without further ado, let's get right into the study as follows. Well, let's look at the data first. So here is how the study was done. Look at the adults and how they were followed, and you see basically the starting baseline they had to work with, 26.8. 85% were already deficient. These individuals which should be paying particular attention to vitamin D levels, but however, though, right off the start, boom. And there's the treatment strategy. To go a little further into it, 21%, as you look a little farther down, still did not make that 40 nanograms a milliliter, which is really interesting because even though that's a secondary outcome, I'd be quite curious to why that 21% could not achieve that 40 nanograms per milliliter that the researchers were looking for a target. And they measured the blood levels about every 3 months. So that makes this study quite unique as we're actually looking at blood levels, not just intake. And it also brings up an interesting question, why so many couldn't reach those higher levels? So let's get into the study as follows. Participants were randomly assigned to 1 to 2 groups. The treatment group received targeted vitamin D supplementation to achieve optimal levels with ongoing dose adjustments every 3 months based on blood testing to reach and maintain vitamin D levels above 40 nanograms a milliliter, but not over 80, as we stressed prior. There was no vitamin D monitoring or dose tailoring for patients in the standard care group. They were just going through the rigmarole care. So we're not looking at individuals that weren't being cared for. We're looking at the individuals that were being cared for and then the group that took the vitamin D as well. All right, let's look a little further at the study itself. All right, here were the real-world results. Of those who are making the targeted group, look at the basically the whole thing. The targeted vitamin D reduction was about half, between 7.9% that had the usual care and 3.8%. That was statistically significant, even with the non-responders being at 21%. So grouping them all together, even though they didn't reach that 40 nanograms a milliliter, they still were about 3.8% compared to 7.9% as standard care. Quite significant. Now, overall, heart disease, basically death, stroke, heart failure, heart attack, including the non-responders, there was a trend towards improvement. But when you add in those group of individuals who are now responders, you had that trend, but not enough to reach a statistical significance as you see right there. But still, that dilutes the data. To proceed forward, all right, we'll look at basically what happened to those that hit the target. This is quite interesting. Look at that. The reduction in all events, the heart attacks, the death rate. Look at the death rate. 46% reduction in those who reached that target of 40 nanograms per milliliter at about an average of 5,000 IUs per day of vitamin D, D3, but in particular, of those being monitored as well by their healthcare professional. That is quite astounding. To get back into the study a little further, to the backstory. Previous studies found that low vitamin D levels are linked to worse heart health. The Target D randomized clinical trial included adults with heart disease who also had a previous heart attack to determine whether achieving optimal levels of vitamin D blood levels could prevent future heart attacks, strokes, heart failure, hospitalizations, or deaths. More than 85% of participants began the study with vitamin D levels in their blood below that 40 nanograms milliliter. a level many experts believe is insufficient for optimal health. Some peers do, others don't. Unlike earlier vitamin D randomized trials that use standard doses, the Target D trial personalized the dose based on the results of each participant's blood test. So again, why that 21% of non-responders was there, that's for future studies. Be really curious about as well. All right, now I'll go a little further into the research as follows before we go to the conclusion. This is for the researchers, if you want to break the data down on your own. For the healthcare professionals, this is kind of basically how the trial was conducted, so on and so forth. Leave it there for a second. And then let's look at the conclusion, and then we'll come to the bottom line. The conclusion, quote, we took a different approach. We checked each participant's vitamin D levels at enrollment and throughout the study, and we adjusted the doses as needed to bring and maintain them in the range of between 40 and 80 nanograms a milliliter. So a lot of individuals may want to get their blood tested to see exactly where they're at. Most likely you're at 26.8, but however though, be nice to be in that 40 range. And again, work with a healthcare professional. Now the takeaways. The treating target works. The standard dose, in this case to the research, was often too low. It required equipment. They looked at it about 5.2 months, they said here, and they found it to be exceedingly safe. And there's your quick reference as far as breaking it down metric-wise, so to say. And that was quite astounding. So you look at it, what the researchers did, which was unique, is not just give someone a 5,000 IU vitamin D capsule per se. What they did is they actually measured those blood levels and found out that some individuals quite often did not respond to even at high doses of vitamin D intake, whether that's digestive issues, magnesium issues, and so on and so forth. That's for future studies to basically postulate upon. But still, just the same, vitamin D, for those that do respond, the reduction in death rate, heart attacks, so on and so forth, is quite remarkable, and it could save many, many, many people, about to say heartache, that's not the way to put it, challenges in the future health-wise. Again, gratitude to the researchers. This will help a lot of people and explain a lot for researchers and healthcare professionals. I am humble you watch and look forward to seeing what both you being you, and I discover next week. All right, catch you all next time. See you then. Bye.